have a quiz. It seemed to be a big success 2 weeks ago, and we hope it will again today. 2 weeks ago, I made reference to Ed McMahon and Johnny Carson, and that seemed to have stumped absolutely everybody. So today I'm referring, as I think about the quiz, to Donna as Karnak the Magnificent, because she is our quiz master here. So Donna, let's turn this over to you for your presentation and the quiz.
Great. Thank you, Jerry, and welcome to the other panelists. I'm not sure Karnak is going to trigger any more memories than Ed McMahon, except for people over a certain age. But in any event, welcome to everyone. As Jerry said, we're going to do this in 3 segments. We're going to do a quiz first. We have 10 questions, some of which were based on questions that we couldn't get to 2 weeks ago, and some of them are based on new information that continues to evolve. The second thing we'll do is a very brief overview of where COVID is in New York City and New York State, and a little bit of an update on where we are with vaccines. And then we'll turn to your questions. So please put your questions into the Q&A box. I'll sort through them. And we also got some previously. So I think we're ready to start with the quiz. Robert, if the men behind the screen can help. Here come your quiz, and then what we're going to do is we'll go over the answers after you have completed the quiz. I know we have some people who are still joining. I'm Donna Lynn, the university's COVID director. I'm joined by Jerry Rosberg, Wafa El-Sadr, and Melanie Bernitz. We are your panelists, and we've posted a quiz. If you take a couple of minutes to answer the questions on the quiz, we'll start showing you the answers and then explaining some of the answers. Much like we did 2 weeks ago. So if you've just joined, there should be a quiz that you see. We'll give everybody another couple of minutes to complete the quiz. And then, as I said, we'll go into the answers. And many of you have found the Q&A box, so please put your questions in. We will have at least 30 minutes to get to these questions. Robert, how are you feeling about submissions? Can we close the quiz out? All right. Okay, so I'm going to ask Melanie and Wafa to help explain some of the answers. And it looks like, at least from the first 3 questions, we have quite a split in terms of some of the answers. So I'm going to start with Melanie and number 1. I've had both my vaccine shots, so now I can host a party with other vaccinated people without masks. Melanie, is that true?
Gosh, no, that is absolutely false. We are asking no one to host a party, but there is some change in New York State guidance for those who are fully vaccinated. And it does allow those who are fully vaccinated to visit with other fully vaccinated people indoors without wearing masks or physical distancing. But that's not a party, that's a small gathering. The new guidance also states that fully vaccinated people can visit with unvaccinated people from a single household if those other folks are at low risk for severe COVID-19. So this is the kind of thing that's allowing grandparents to visit with their grandchildren now once they're fully vaccinated. But again, the emphasis is fully vaccinated people should still be taking the same precautions in public, like wearing a mask and physical distancing, and absolutely avoiding medium and large size in-person gatherings.
Great, thanks, Melanie. And obviously, I think the operative word is small, and people that you know and might trust to give you a correct answer about whether or not they've been vaccinated and when they've been vaccinated. But if that's uncomfortable, in any event, keep wearing those masks. So
and Donna, if I can also add, remember, what does fully vaccinated mean? And I don't think we're covering that in one of our questions today. So just a reminder, fully vaccinated means you've completed the course. And remember, for Pfizer and Moderna, that's 2 doses. For J&J, it's 1 dose. And then 2 weeks after either your second dose on Pfizer or Moderna, or 2 weeks after your dose of J&J is when you're considered fully vaccinated.
Great, thank you. The testing and quarantine restrictions for travel have recently been updated. We're going to spend a little time later on. I think we'll stipulate right now they are very confusing. So the answer to question number 2, that there will be no restrictions on domestic travel, is that true or false, Melanie?
That is in fact true, that New York State is lifting that domestic testing and quarantine restriction effective April 1st. But remember that the keyword here is domestic. International travelers still have quarantine requirements. And in fact, those international requirements as put out by the CDC have actually become stricter than they were before. There used to be some equivalency between these two, but now for international travel, even with testing, the minimum quarantine is 7 days upon return, and it can be 10 days. But yes, next Thursday, I believe, is April 1st, and that's when the domestic restriction will be lifted. Great,
thank you. All right, number 3 is a little bit of a trick question. The university is now operating 4 vaccine locations. Melanie?
It is a false answer, so those who said true, not quite yet. Currently, the 168th Street location is operational, and we're hoping that self-scheduling for that site will be available starting next week. The other sites will become operational in April, we hope, and that is the site at Lerner Hall, at 103rd and Broadway, and at West 51st Street. So stay tuned. We'll continue to post updates. There are a lot of factors that feed into the opening of these sites, and as soon as they're able to be operational, we will open them.
All right. Question number 4. Everyone in New York State can get vaccinated now based on recent expansion of vaccination eligibility. Melanie?
False. Unfortunately, we're not in Alaska. So New York State continues to expand our vaccine eligibility, and as soon as we post something, they do seem to change. So the latest update, which came into effect at 8 o'clock this morning, is the expansion to include anyone over age 50 in the age category. So who's excluded right now? Anyone under age 50, unless they meet other eligibility categories, such as essential workers, having an underlying medical condition, and those criteria. And again, children under 16 have no approval. So right now, a child over 16 who has an underlying medical condition can be vaccinated, but children cannot. We are seeing these changes, these updates happening on an almost weekly basis, but obviously the inclusion of the age 50 plus is a large group. So we're going to have to see how that demand meets supply in terms of when the next expansion will come.
All right, we're going to go to number 5. We've already got 34 questions. So let's go to number 5, which is residency restrictions for vaccination appointments have been removed in New York. You can go to the next slide, Robert.
And that one is correct. You do not need to be a New York City resident. If you work in the city, you can receive a vaccine in New York City, and the same is true in New York State.
Great. We're going to turn to WAFA. 40% of U.S. residents have now been vaccinated. You're on mute, WAFA.
Apologies, it takes a while to find that button, but this group today, you're correct in that this is false. As of this afternoon, only about 14%, not 40% of the population of the United States has been fully vaccinated, meaning again, based on the definition that Melanie just shared with you. So we have a long way to go in the US to getting to where we want to get to in terms of uptake and coverage with these vaccines.
Great. Number 7, vaccinated individuals are not fully protected from getting COVID-19.
And again, this is true. We know that the vaccines are very good. They're excellent. They have very high efficacy, as has been noted in several of the studies that we've discussed on these webinars, and they decrease the risk substantially So somebody who's vaccinated versus somebody who's not vaccinated is protected to a very large extent. Nonetheless, the risk is not zero. And therefore, that's why we, again, strongly recommend that people remain vigilant and observe some of the public health measures, protective measures. And also, that's the reason why we encourage individuals to continue to get tested and so on as per the Columbia testing plan.
Great. The next question is about the mRNA in the Moderna and Pfizer vaccines and whether it can enter the DNA. And we've actually already gotten a couple of questions in particular about women who are considering getting pregnant or are pregnant. So Wafa, tell us a little bit about how this one works.
Yes, and again, the audience is correct, is that this is false. There's been major concern about this issue and on social media in particular. And I think it's really important to remind everyone that the mRNA, once it enters into the cell, and with the purpose of stimulating our cells to produce the protective antibodies, it degrades very rapidly and it does not enter the nucleus of the cell. And therefore, it does not enter the DNA in our bodies. So that's reassuring, hopefully, to individuals who are considering getting pregnant or are currently pregnant.
And then our last two questions, Wafa, I'll toss at you as well. The COVID tests do not work as well after you get vaccinated. True or false?
That is false. And we know that the tests continue to work just as well after vaccination as before vaccination. There's a bit of confusion in terms of the antibody testing. The antibodies that are produced based on the vaccine are different from other antibodies that are usually measured when people get an antibody test. So our PCR testing, our antigen testing, antibody testing continue to be of value, even after vaccination.
And then our last question, vaccine hesitancy, a topic we hear an awful lot about. Has it increased, decreased, or remained unchanged since we launched the vaccine campaigns?
The good news is that the vaccine confidence has increased, or vaccine hesitancy has decreased with every survey that has been done since probably throughout last year and throughout early months of this year. We see consistently that hesitancy is decreasing overall, and it's decreasing again substantially over time, but nonetheless, we continue to see the disparity that we've talked about before in terms of disparity by race, by ethnic group, and other parameters as well. So this is good news, but we still have a lot of work to do to continue to enhance confidence in these vaccines amongst our communities.
Okay, great. Well, thanks to the audience for participating. Why don't we go to the first slide in the presentation? You can keep going. All right, great. I'm going to do a very short overview of where we are in terms of COVID. You can go to the next slide. So I like to say that despite a lot of reopening activities, that our numbers are still very concerning. Just on March 20th, the day for which we have the most recent data, as you can see, over 6,000 people who were tested that day ended up testing positive. We had close to 5,000 people in all of our hospitals. We had a substantial number of people who died, and the positivity rate is over 3%. If you recall back in, and I'll show you a chart in a minute, for a good 5-month period, our positivity rate was between 1% and 2%. So our numbers are staggering. And in the city, they are equally staggering, if not worse. So the important number is the positivity rate, which in the city is 6.51% as of March 13th. That's a little dated, but the city has got a little data delay going on. And actually, the mayor today urged caution because there are 25 zip codes in the city where the positivity rate is over 10%. Again, that's a very significant number, and maybe doesn't align with going to movie theaters and opening up restaurants and all the other things that are doing. Why don't you go to the next slide? So this is a great picture to show you over the past year what this has looked like. Back in April, some of our darkest days, we were seeing about 10,000 cases a day. And if you go over to our peak, which was in sort of the second to third week of January, which we expected some based on holiday travel, you can see that the peak was much, much higher. So today we're below the peak that we had back in April and certainly what we had in January, but a very concerning number that isn't dropping. We'd like to ski, I like to say, we'd like to see that ski slope on the mountain go straight down, not level off the way that it has. So we still have a very serious situation in New York, and we want, as you know, to keep Columbia's campus and our neighbors safe. You can go to the next slide. This just gives you a little bit of a picture of what I was talking about. The darker the area, the worse the positivity rate is. And again, Staten Island, it turns out, and parts of Brooklyn and Queens are seeing the highest rates. Manhattan is always, for the most part, seeing the lowest rates, although up here on the medical campus, we are seeing rates in the 7 to 8% range. You can go to the next slide. All right, let's keep going. So just as a reminder, and Jerry mentioned, we have a very comprehensive COVID testing program that's free. We have instituted as of the spring semester, a mandatory, we call it a return to campus or gateway testing program for everybody, even if they've been on campus throughout the entire fall term. Undergraduate testing was increased to twice a week from once a week. And we still have, I'll show you the website. If you haven't seen the COVID-19 website, you can get a lot of this data from that website. We've got 46 of our affiliates in isolation, meaning they are COVID positive and they have to isolate. These are people living on campus. And we have 79 who are quarantined because of a possible exposure. We're getting close to doing 200,000 tests across the two campuses and even some at Lamont that we do. But unlike the city numbers, remember, I'll take you back to the state being 3% and the city being 6.5%. We are this past week at 0.32. So great safety measures and compliance that we've experienced here at Columbia. You can go to the next slide. And this just shows you a snapshot of what that data looks like. Again, you can see the 191,000 tests. We've had 757 positives over that period from June 22nd until today. So a very, very low number. You can go to the next slide. All right, so let's focus on the vaccine. I know that's probably front and center on everybody's mind, and we've touched on some of this, but as you know, the state is rolling out eligibility based on categories. The first category on December 15th that we rolled out were patient-facing faculty and staff and students. Quite frankly, we have some up here, as you can imagine. They were in hospitals, healthcare facilities, nursing homes, and there was a big push to get them vaccinated in the first 3 weeks or so of the program. The program, as you heard, is expanding pretty much every week. New categories have been added. So in January, a group of front-facing individuals, whether they were transit workers, teachers, restaurant workers, were added. An age eligibility was set. Initially, it was if you were 75 and over, you could get vaccinated regardless of your working situation. Then it dropped to 65. And actually, as of this morning at 8 o'clock, it dropped to 50. Also, last week, the governor added certain other essential government and nonprofit workers. Those who are in person, and it applies to a number of people on the Columbia campuses who were unable to get vaccinated before. And in addition, persons with underlying medical conditions, including pregnancy, the conditions that you see there were eligible to begin getting vaccinated about 3 weeks ago. As you saw in the quiz, we have 4 locations that we are planning on opening. We've actually had a slight change in one of these. 168th Street has been open for a week and will continue to stay open for several months. The 51st Street location will open up in 3 weeks. We'll talk about Lerner Hall and get an update from Melanie, but we will be opening up Lerner within the next several weeks. And then we have a location in Westchester at 15 North Broadway that will open up April 12th. So you can go to the next slide. So I guess the number one rule that we have to understand with the vaccine is that the demand exceeds the supply, and particularly as we open up new groups. We are not finished even with the 1A category of patient-facing employees. Some employees have chosen not to get it or to wait to get it. And so we're not through 1A as we continue to open up the 1B categories. There are many rules about who can get it. And Melanie mentioned Alaska. There are some states where there are no rules. So the rules aren't set by the federal government. They're guidelines from the CDC, and then the individual states, and in some cases the city, set the rules. So you may know, Connecticut is not doing underlying medical conditions. They're just going in age order and doing teachers. And there's all kinds of variations across the country. Those great results I showed you with respect to our low positivity rates have been achieved not because people got vaccinated. They were achieved because people were adhering to whether it was physical distancing or mask wearing or 50% occupancy. That's what has gotten us our low rates. We have only vaccinated, as you can see below here, about 10,200 of our affiliates that we know of. We don't know if affiliates have gone to city sites. We don't have that data yet, but we will have that data to get a fuller picture shortly. We are using 3 vaccines in the United States and in New York, Pfizer, Moderna, and J&J. Although the vaccine that is being used now, and we suspect will continue to be used, is the Pfizer vaccine here at Columbia on the Black Building campus, and likely on at Lerner. Although J&J is easier, we have not seen the supply come to us for J&J. You can go to the next slide. So the next few slides I'm going to go through very quickly. They're complicated, and there's a lot of questions that don't relate to travel and quarantine. But as you heard, these rules are changing frequently. And there's different rules for people who are healthcare workers. Most healthcare workers who are Columbia affiliates are on the medical center campus, but some are not. So, excuse me, just as of today, and we gave you the link. If you have not gotten to the COVID-19 website, you should. It's got a tremendous amount of information. So your link is here. These slides will be posted along with the recording, but you can always go to covid19.columbia.edu, look for the button for quarantine, look for the button for testing, and you'll be able to find a lot of this information. So as you heard Melanie say, there are buckets of types of travel, domestic travel and international travel. And suffice it to say, the rules are generally stricter when you're doing international travel. These rules apply to healthcare workers. And again, they're designed to get healthcare workers back into the healthcare workplace because it's so important for them to serve patients. But they're also designed to make sure that healthcare workers monitor their symptoms. They can return to work as long as they are asymptomatic, but there's a little more leniency built into the rules now for healthcare workers as of today. You can go to the next slide. As I said, the rules for coming back from an international destination are a little more difficult. You need a negative test 3 days before boarding a flight to the United States. One of the reasons why we don't encourage international travel is partly because of that. You could be in a country and not be able to be tested. And then there's a requirement for quarantine as well. You can go to the next slide. So for non-healthcare workers, as I said, the rules are also changing. There are requirements around quarantining during certain periods of time. Again, we continue to urge following all guidelines. Whether you're vaccinated and your test is negative, you still need to follow face coverings, hand washing, and social distancing. You can go to the next slide. And again, you can see these are 2 weeks ago. We wouldn't have had these slides up here because they changed. We've been advised they're going to change again. So continue to monitor the COVID-19 website. And then there are much more lenient rules when it comes to individuals who travel outside of New York on the contiguous states, Vermont, Pennsylvania, New Jersey, Connecticut, etc. And if you are traveling for less than 24 hours, you don't need to test, you don't need to quarantine, you do need to fill out the forms that the state mandates, and you do need to take a diagnostic test after you arrive in New York. And importantly, if you develop symptoms, there is a website where you can go to a link and report your symptoms. You can go to the next slide. And then for more than 24 hours, as I said, the rules are stricter. These are general rules not relating to healthcare workers. You can go to the next slide. And then there are separate rules, just to confuse you even more. If you're not a healthcare worker, but you've been vaccinated, the current rules, and I say current because we've been told these are going to change as well, is that you don't have to quarantine if you've gotten your 2 doses of Pfizer or Moderna or 1 dose of J&J, excuse me, and there's 2 weeks that have gone by, but you're still within 90 days of when you got your vaccine. So you can see it's a really narrow window, and many people right now are in danger of exceeding that 90 days. We expect that to be lifted. And even when you're not required to quarantine, again, you've got to manage your symptoms, and report to COVID test trace at columbia.edu. Next slide. All right, and I think this is the last slide. So again, more rules about if you have positive tests, when you need to quarantine. You can go to the final slide. And then if you are vaccinated, there are a number of additional rules, as I mentioned, relating not to travel, but to exposure. So it's important that you monitor. If you're asymptomatic, you don't have to quarantine after exposure, again, based on those certain categories. And I think that's it. Why don't we put the slides down and let's go to some questions. We have 70 questions. And one question, Melanie, I'll go right to you, which is, when will Columbia begin offering the vaccine at Lerner Hall?
So we are working frantically to get the site set up and ready. The rate limiting steps are really just making sure the systems are in place around eligibility, scheduling and reporting, and then the vaccine supply. So we anticipate having an update around that either later this week or early next week, but we're almost there.
Great, thank you. Wafa, I'll turn to you. Is it known whether smoke from tobacco or vaping products can be vectors for COVID transmission? For example, if an unmasked smoker is smoking, can the virus ride on those smoke particles?
Well, I think the virus can certainly, as the person is exhaling when they're smoking, and it's part of just exhaling, whether it's just normal exhalation when they're pushing the air out of their lungs or through smoke. I think that's how the virus is transmitted. So I think it really, irrespective of whether they're smoking or not, it's the act of actually pushing out air from the respiratory system that allows for transmission of the virus. And that's one of the reasons why we again recommend the masking, which protects others as well as obviously we know it protects the person who wears the mask as well.
Jerry, I'm going to turn to you with a question about whether or not there is a reason to get the vaccine through a Columbia site versus a local clinic.
There is none at all. It may, in some cases, be easier. If it is to get it at Columbia, you should do that. But I think consistently the position has been the right vaccine for you is the one you can get. And as these eligibility rules have expanded, what's unfortunate is that the supply of doses isn't going up with the expansion of eligibility. But I think the invitation to our people is to get on those state and city websites and find appointments. They are there, and a lot of our people are succeeding in getting vaccinated.
Great, thanks. And Jerry, I would just add some of them have extended hours into the weekends, into late into the evening, and that may be just more convenient. Melanie, let me turn to you. And the question relates to that new category that we established, or that was established by the governor, which is essential in-person or public-facing employees. Does that allow Columbia employees to be considered essential workers and to be given priority for the vaccine?
So it does if you're expected to be working on campus. So it really did open up the eligibility for our faculty and staff who are teaching in person, who are working in person on campus. So it certainly has expanded it. However, if someone is working remotely and is not needing to be on campus, they are not considered essential as far as our eligibility goes right now, but they may be falling into an age or chronic condition category.
Great. And one maybe twist on this is we know that we will have people coming back in May and June for summer teaching, for example, or because they're otherwise coming in, and we are going to allow you to get vaccinated so that the vaccine, 2 doses, if we're doing a Pfizer, would be finished by the time you arrived onto campus. Wafa, I'm going to add, there's some questions about variants. Could you discuss the efficacy of the vaccines with the variants that are being reported?
Sure, and I think the question was about the vaccines that are available now to us here, which are the Pfizer, BioNTech, and Moderna, and the Janssen vaccines. And I think in general, most of the data that are available are based on in-laboratory testing. So for example, taking the blood, the plasma from someone who has been vaccinated and then testing it against viruses that have been developed that are like the variants, and the various variants that have been isolated from different parts of the world. And in those kind of laboratory setting, there is some evidence that the level of protection seems to be lower against some of these variants. However, the researchers still believe that even though that's the case, that there's likely sufficient antibodies, sufficient level of protection against some of the variants that have been reported. I think there are, though, some other, I think what we all await are more of the clinical studies, the studies that are in the community to actually see whether this will translate in protection against some of the variants in real life. And many of these results hopefully will be coming out soon.
Great, thank you, Wafa. There were a number of questions about the variants. So one question I'll answer. The question says, are any of the Columbia NYP sites open to 50 plus yet? Yes, we are open in the Black building for 50 plus. Now, the question that you have to ask yourself, and I apologize for not giving it to you as a statement, is how do you get an appointment? And beginning on Monday, the 29th, you will be able to self-schedule appointments in the Black building, and we'll also have self-scheduling tools for the other locations. So if you want, and you have to wait till Monday to get an appointment for next week or the week after, you go to vaccinetogethernewyork.org, and there will be a drop-down menu that gives you locations, okay? And as I said, several of the locations opening date will be April 12th. Okay, there's a couple questions, Wafa, if you could answer about AstraZeneca and all the controversy that's going on with AstraZeneca.
Yeah, unfortunately, the AstraZeneca Oxford vaccine has gone through a lot of ups and downs since it first appeared. First, there was the discrepancy between the results of the vaccine studies that were done in the UK versus the studies that were done in Brazil. And the problem there was that because of an error, the individuals who were vaccinated in the UK, they received half the dose initially and then the full dose, second dose. So that the thought was that was the reason for that discrepancy. Then there was another issue that arose, which is of course the fact that the study, a small study, nonetheless, a clinical study was done in South Africa that showed that the AstraZeneca vaccine had very limited efficacy against the dominant variant that was first identified in South Africa. That study did not have sufficient participants in it to be able to say anything about whether AstraZeneca would prevent severe disease in that context in Southern Africa. And then the third controversy was the issue about what's called thromboembolic events as side effects from the AstraZeneca vaccine. That was last week in the media. Several European countries stopped vaccination because concern about the occurrence of events like strokes, for example, or pulmonary emboli or deep venous thrombosis. But then after a deep analysis and looking at the data from these cases, it was noted that the rates of these events amongst people who've been vaccinated with AstraZeneca were no different from the rates in the general population. So many of these countries restarted their vaccination efforts with AstraZeneca, and WHO supported vaccination with AstraZeneca. And then lastly, the fourth controversy is what we heard about yesterday, is we woke up yesterday with the good news that the big, large study that was done in the United States, in Chile, and in Peru, that recruited 34,000 people that we've been all waiting for, had shown an efficacy of 79%, which is great, and actually was 100% efficacy against severe disease. So all of that was really good. But then again, this morning we woke up with information that somehow it appears that the company had cherry-picked the data that they shared with the independent data safety and monitoring board. So this obviously is quite a terrible situation, and I think the company has said that they are going to share a whole new set of data for analysis and review by the independent data safety and monitoring board. It's a long saga, and unfortunately, it's really a sad saga.
Thanks, Wafa. Jerry, I'm going to turn to you. We have a couple questions about eligibility. So can faculty who are non-patient facing get the vaccine, and can they get it at Columbia?
So if you're patient facing and you're faculty, then of course you're eligible. That's category 1A. If you're not facing patients, but you are in the classroom and you're teaching, then you're eligible on that basis. If you're not in the classroom, but are in the category of people who are working on campus, doing research or other activity on a regular basis on campus, you should also be eligible by that criterion. And then finally, of course, you may be eligible by reference to your age or underlying condition. So there really are a lot of ways to be eligible right now. And if you think you're eligible, you should make an appointment and go in. If your claim is that you're eligible by virtue of working on campus, showing your university ID is really all that should be required when you go into to obtain your vaccination.
Great, thanks, Jerry. And maybe a related question, what about the family members of Columbia affiliates? Can they get vaccines at Columbia locations like Lerner or like CYMC? This is kind of a trick question.
So my understanding is, but Donna and Melanie, I need you to confirm this, but my understanding is that those sites that you've described will be for affiliates only, and that family members would not be eligible. Is that correct?
No.
Donna tricked you, Jerry.
That's true for Lerner, but for the Columbia sites, we consider you a patient, and we will enroll you as a patient. Good. And so as I mentioned, that self-scheduling tool that is going to be available on Monday, your family members can go to vaccinetogethernewyork.org and sign up for what we call a Connect account, and they can then get an appointment to be vaccinated.
So okay. I can see that my role here is to provide comic relief, and I'm glad that I've come through and done that. But so at Lerner, that will be affiliates only.
Lerner is affiliates
only. It's the other sites. Okay.
Yes. No, Jerry, it's just to show how complicated this all is. Right. Really is. Wafa, are the people vaccinated in the pilots for Pfizer and Moderna being followed to see how long antibodies last?
Yes, absolutely. The people in all of the studies, not just the pilots, but the big, large phase 3 studies that had 30,000, 40,000 people, individuals continue in follow-up. And I think the intent is to see what happens to them over time, the level of antibodies, how long protection lasts, and so on.
Thank you. Melanie, we have a question. Do you test positive right after you are vaccinated?
If you do, it's absolutely nothing to do with the vaccine. So that's an important clarification. The vaccine has no impact on the testing capability. It's working on two completely different things. And we're talking about PCR tests, right? The tests that the nose swabs, the oral swabs, saliva tests, not the antibody tests. So if you do test positive after getting a vaccine, it's because you were infected before you got your vaccine. So we're really recommending that everyone continue with their testing, regardless of vaccine. We're still including vaccinated individuals in our random sample, which is required, and the vaccine will have no impact on the on that test and its efficacy in terms of detecting the viral DNA.
Great, thank you. Melanie, I'm going to stick with you because the CDC recently changed their guidelines around physical distancing in schools. The question is, how does the new guidance regarding that distancing impact our ability to open the university for faculty working on site and the K through 8 school?
That's a great question. So the CDC last week updated their guidance talking about reducing distancing in schools from 6 feet to 3 feet when a number of other criteria are met, including the local positivity rate being below certain levels. They still believe 6 feet is ideal, but this does allow some reduction in that. Right now, the best evidence for this is in the K through 5 age group. Once you even get to the middle and the high school grades, that's becoming more complicated. And the CDC has not yet published any guidance for this in the higher education sector. As with all other things, and I think we shared this previously, when CDC puts out recommendations, and they're just recommendations, they're not rule, then the local authorities examine them. So New York State has not yet provided any guidance in terms of what they're recommending around this. So right now, it really doesn't give us that much, except for obviously us being able to look at what would happen if we reduce 6 feet to 3 feet, what would happen to capacity changes. But as of now, we're still awaiting further guidance.
Great, thank you. I'll take this one to give everybody a pause. It's if I have been vaccinated, should I still be tested weekly on campus? You are welcome to be tested weekly on campus. That's number one. You are required to come in for a 10% sample when you are called. And obviously, if you're coming in, you've got your gateway test. So if you're not a student, there's flexibility here. If you're a student, as I mentioned, you have to come in twice a week. And as you heard before, there's a two-part question. The vaccine does not interfere with test results. Okay. Wafa, I'm going to turn to you. Why aren't we doing more antibody and antigen testing after a period of time after the vaccine or after someone has COVID to see if the individuals still have immunity?
Well, I think there are, I think the regular test that is done for antibodies that people can do, antibody testing, is qualitative. It just says positive or negative, and it doesn't really determine whether people have what's called neutralizing or binding antibodies, which are thought to be the specific types of antibodies that are protective against getting COVID-19. So just getting the test, the usual antibody test is not helpful in that context. You have to measure the amount of antibodies actually quantitatively, and you also need to determine what kind of antibodies. So that's the reason for doing so. Antigen testing is largely, again, it's another way of looking at making a diagnostic test. It's not as good as the PCR test, which is what we're doing here at Columbia, but it's really, if it's positive, it means somebody has been infected, although its performance of that test is not as good as our PCR test. So thus, in the context of just regular routine follow-up, doing neither of them would be useful.
Great, thank you, Wafa. Just a couple of questions about herd immunity. Could you clarify what percentage of the population must be reached in order to get herd immunity?
Yeah, I can address that, and that remains kind of you know, not controversial, but there's not a deep consensus on this. But it's thought that at least between 70 and 85% of the population needs to be either protected by a vaccine or to have had a protective antibody from prior infection. So as we mentioned before, up to now, only about 14% of the U.S. population is fully vaccinated. So we have a long way to go with vaccination and natural infection to be able to say that we have reached herd immunity.
Great, thank you. Melanie, there's a number of questions coming up, and again, we're trying to not answer. There's a few that I'm answering live, but a number of people are saying, when should, if I've tested positive for COVID, how long should I wait before I get vaccinated?
Yeah, that's a great question. So in general, for most people, you can get vaccinated as soon as you've recovered from your infection. So you have to complete your minimum 10 days isolation, maybe longer. If you're hospitalized, it may be a 20-day isolation, and then you can get vaccinated. The only exception is if you receive monoclonal antibodies as part of your treatment. Then the recommendation is to wait 90 days before vaccination, because there's a question as to whether or not you'd have such a robust antibody response. So for most people who have a mild course, if you're managed at home, you can absolutely receive the vaccine as soon as your isolation period is complete.
Great, thank you. Jerry, I'm going to turn to you because you're our human resources czar. And this question, it comes from someone who may have, I think, participated in another one of these webinars, but will Central University Administration be potentially offering some kind of flexible work structure to allow remote work from staff?
So there's a tremendous amount of work underway right now on this very structure, on this very question, and we know we're going to need new structures. There are lessons we've learned, and we have to apply them. What I think you should expect in this score, we're hoping to have an announcement out in the next few days that will provide some guidance on this. So let me just preview this here. What you're going to see is that there's not a single university-wide policy that says either everybody can work remotely or no one can work remotely. This is something that's going to have to be figured out at the school and department level, taking account of the particular needs and responsibilities of the unit and the function of particular individuals. So there will be a lot of work and conversation about this. It's not something that's going to be left to each individual to ask, where do I do my best work? Should I stay home or should I come in? That we need to do some really good workforce planning to make sure that we're deploying our people in a way that gets them where they need to be and is consistent with the health and all the public health guidelines that we're under right now. So just one last comment on that. We don't want everybody rushing back tomorrow. That's not a good result because of the density requirements that we've got. But it is safe on campus, and those of you who will find yourselves coming back over the next few months will, I think, be very reassured by what you find here.
Thank you, Jerry. Melanie, we have a question about, do we have an estimate of when all staff will be able to get the vaccine, aside from the eligible groups that have already been identified?
We really don't, because that's going to be governed by the state eligibility categories and how quickly they open up. And even as Jerry mentioned earlier, if they open up, it's dependent on the vaccine supply.
Thank you.
We did hear that there's hope that everyone will be eligible by May 1st, but again, supply dependent.
Melanie, is there any more information on how long vaccines last?
No, it's still emerging data. So there's still a lot of follow-up going from the original Pfizer and Moderna trials, just looking at how long those antibody responses last. And that's going to then feed into the research that's going on in terms of whether or not we're going to need boosters and how often we're going to need those boosters.
Great, thank you. Wafa, we have a category of patients who are called long haulers. They still have some symptoms long after maybe they're discharged from the hospital or for months. Are the vaccines showing any promise in helping the long haulers?
We have no evidence as of yet to say that that the vaccines are helpful for long haulers. There's anecdotal kind of one by one kind of reports of some persons reporting some amelioration, some relief of some of the symptoms, but there are ongoing studies to try to understand better the whole long hauler phenomenon, and as well as, of course, to identify ways of supporting and trying to manage some of this some of the debilitating symptoms that these individuals are experiencing. So stay tuned. We don't have data as of yet, but this is something that's being looked at.
Great, thank you, Wafa. We have a question, and maybe Jerry, I'll let you answer this one. It is, New Jersey has the worst COVID numbers in the country. Why would we think it is safe for employees to commute between New York and New Jersey?
So I don't think this is our decision. I think this relates to these domestic travel quarantine rules, which are so peculiar. They not only change rapidly, but they often don't make a lot of sense. And I think what happened was, and others may have a clearer understanding of this, but I think what happened was that the travel quarantine rules started in partnership with New Jersey and Connecticut, and all three of these states seemed to be safe together. When those states stopped being so safe, the governor didn't know quite what to do, so decided to just exempt the contiguous states and let people go back and forth. But in any event, this is not our decision.
Great, thank you. There's one I'll take. It's an easy one. This is an individual who received their Pfizer dose, their scheduled appointment, and whenever you go to get your first dose, you get a second appointment. It's 21 days later. That is correct. There is a difference between Moderna and Pfizer. So there's a 21-day period between the first and second dose for Pfizer, and a 28-day period for Moderna. And again, J&J is one dose, so you get it and you're able to move on. Melanie, there's a question. Do we still recommend the weekly voluntary testing even for employees who are vaccinated? I think we covered that, but we not only recommend it, but again, you can talk about students.
Yeah, absolutely. We continue to encourage it. Our undergraduates are getting twice weekly testing regardless of vaccination status. Voluntary testing is available for everyone regardless of vaccination status, and the 10% sample, if you are invited, is required regardless of vaccination status.
Great, thank you. Let's see. My father's a minister. Melanie, I'm going to give you this one. My father's a minister, has been holding church services on Zoom. For Easter, there will be a short in-person service with everyone wearing masks and fewer than 25 people. Should I suggest to him that the church open windows and that the service go on without singing?
The increase in circulation is key, so absolutely. And singing, even with masks, propels more droplets. We were talking earlier about the smoke and droplets spreading further. So reducing any of that singing, shouting, or heavy breathing certainly does reduce risk of any transmission. And as well as him having his masked congregants, making sure that they're all seated 6 feet apart would also be recommended.
All right, Wafa, we're getting close to time. Thanks to everybody for their questions, and I know we have many, many more, which we will filter into our frequently asked questions that show up on the website. And as I said, the website will show this recording as well as the slides. So Wafa, this is a question from someone who wants to know, what can they do to get the vaccine in New Jersey? They don't have any other eligibility in New York. In other words, they're not workers here. What is the best way to get the vaccine?
I would imagine the best way is to examine the eligibility criteria in New Jersey. I don't know these offhand. I think they've been kind of moving in sync with New York, but that would be my suggestion, is to go to the New Jersey Department of Health website and take a look at their eligibility criteria, and then if they fulfill any of the eligibility criteria, to try to get an appointment at any of the vaccination sites. I've been hearing about expansion of vaccination sites in New Jersey. over the past several weeks. So I think access to vaccination is improving in New Jersey as well as in New York, obviously.
Great, thank you. And there's two questions that I just saw there. They're very related, which is there going to be a requirement, or should someone who's been vaccinated outside of a Columbia location or outside of the Armory where NYP is doing vaccines, should they report this to Columbia? The answer is yes, but we don't have a place for you to do that yet. All of that information does go into Department of Health registries, which we'll have access to. But we obviously are going to have employees and students who come from other countries, for example. And so there'll be multiple ways in which we will collect that information. And one reason why we want to collect it is to understand what our community is doing. There weren't a lot of questions about vaccine hesitancy, but we know that hesitancy exists, and we want to give individuals as much information about that as we can. So with that, I'll wrap up. It is just about 5 o'clock. Thank you. We repeat this 2 weeks from now, and we do filter some of the questions and add them into what we get in an early mailbox. So thanks for your interest and concern. And we'll see some of you, I'm sure, and others in 2 weeks. Thanks, everybody. And thanks to Melanie, Wafa, and Jerry.
Thank you. And thank you, Don. Take care, everyone.